Can alprazolam cause headaches? Yes, alprazolam, which is a prescription medication commonly used to treat anxiety disorders and panic attacks, can potentially cause headaches as a side effect. While headaches are not among the most frequently reported side effects of alprazolam, they have been reported by some users. Headaches can occur as a result of various factors when taking alprazolam. One possible reason is that alprazolam can cause drowsiness and fatigue, which may lead to tension headaches. Additionally, alprazolam affects the central nervous system and can cause changes in blood pressure, which may trigger headaches in some individuals. It's important to note that the likelihood and severity of headaches vary from person to person and may also depend on factors such as dosage, duration of use, and individual sensitivity. Here are a few examples of reported cases. User A, who has been taking alprazolam for anxiety for several weeks, experienced occasional mild headaches during the first week of treatment. The headaches were short-lived and subsided after a few days without any intervention. User B, who has been on alprazolam for a longer duration, reported persistent headaches that started a few weeks after starting the medication. These headaches were more severe and lasted for longer periods. User B consulted their healthcare provider, who adjusted their dosage, resulting in a reduction in headache frequency and intensity. If you are experiencing headaches while taking alprazolam, it is essential to consult your healthcare provider. They can evaluate your specific situation, consider any underlying medical conditions, and determine the best course of action. It may involve adjusting your dosage, changing the medication, or exploring other potential causes for your headaches. Remember, this answer is not intended to replace professional medical advice. It's always best to consult a healthcare professional for personalized guidance regarding any health concerns or medication side effects.